In the wake of COVID-19 pandemic in India, citizens have consistently grappled with concerns regarding the virus. The post-COVID-19 landscape has witnessed mutations of subvariants annually. The most recent one being JN.1. It has been designated as a variant of interest by World Health Organization and is causing heightened apprehension due to its swift spread across Indian states, attributed largely to its increased transmissibility. Welcome to Health Chronicles, a podcast by Redcliffe Labs that focuses on empowering health for a healthier nation. I, Ritika Bose, your host, is here with Season 1, Shield Up, Episode 1, Facts You Should Know About COVID-19 JN.1 Variant. The origin of this subvariant in India can be traced back to Kerala, where a 79-year-old woman from Thiruvananthapuram was first identified with this virus. It is acknowledged as a progeny of Omicron subvariant Pirola. Are we going to be masked again? Will we be shielded? Are there chances of another lockdown? How threatful is COVID-19 JN.1 variant? Let's know more about it from Dr. Ashok Rattan, Chairman of Medical Committee and Quality at Redcliffe Labs, who comes with an experience of more than 40 years and was conferred with the APJ Abdul Kalam Award in 2018 for his contribution to medical sciences. Let's hear from our esteemed doctor and know the facts of this virus, JN.1. Hello, doctor. Thank you so much for taking time out and joining us. डॉक्टर हु ने वर्ल्ड हेल्थ ऑर्गेनाइजेशन ने इस वेरिएंट को, इस नए वेरिएंट JN.1 को एज अ वेरिएंट ऑफ इंटरेस्ट डिक्लेयर कर दिया है। क्यों ऐसा है कि इसे वेरिएंट ऑफ इंटरेस्ट डिक्लेयर किया गया है?
जब से कोविड निकला है, we have noticed that there are variations or mutations which occur in the spike protein. Mutations then increase communicability, increase infectiveness, increase severity, and sometimes also give increased escape of immunity. So ये characteristic देख के WHO ने CDC के साथ, CDC अटलांटा US की जो बॉडी है, उनके साथ क्लासिफिकेशन किया कि वायरस को, ये वेरिएशंस को 4 कैटेगरी में डिवाइड करेंगे. First and the worst one is variant of high consequence. Up till now, none of them have been classified as a variant of high consequence. Then the second category is variants of concern. And variants of concerns have been 5. Last we had Delta. After that we had Omicron. उसके बाद है वेरिएंट ऑफ इंटरेस्ट, जो जिसमें ज़्यादा कंसर्न नहीं है, बट इट हैज़ टू बी ऑब्जर्व्ड. एंड ऑफ कोर्स अदर वेरिएंट्स आर वेरिएंट्स अंडर मॉनिटरिंग. सो सर्विलेंस में यह है कि हर एक वेरिएंट को मॉनिटर करना चाहिए, क्योंकि हार्मलेस भी म्यूटेशन होके वो कॉन्सिक्वेंस कर सकता है. So इसको पहले, so that means all variants are under monitor. So variants under monitor को 4th category जो है वो 3rd category में कर दिया है. That means variant of interest. That means now we'll monitor it closely and see whether it causes severity, whether it causes concern or it doesn't cause concern.
तो जैसे इससे पहले हमने देखा था और भी सब वेरिएंट्स, हर साल एक नया वेरिएंट आ रहा है. जब से कोविड-19 हुआ है एंड वी ऑल हैड कंसर्न्स रिगार्डिंग द सेम, उसके बाद से हम देख रहे हैं कोई ना कोई सब वेरिएंट हर साल आता है. ये जो इससे पहले जो सब वेरिएंट्स आ चुके हैं, स्पेशली जो लास्ट वेरिएंट था ओमिक्रॉन का पिरोला, उससे ये जो नया वेरिएंट आया है अभी JN.1, हाउ डिफरेंट इज इट?
इसमें एक म्यूटेशन, एक और 30 mutations were already there. ओमिक्रॉन के स्पाइक प्रोटीन, जो कोविड का जीनोम है, दैट इज 30,000 किलोबेस, मगर उसमें जो म्यूटेशंस होती हैं म्यूटेशन कहीं भी हो सकती है, क्योंकि आरएनए वायरस है, आरएनए वायरस में म्यूटेशन होती रहती है, मगर स्पाइक प्रोटीन पे जो म्यूटेशन होती है वो ज़्यादा इंटरेस्टिंग हो जाती हैं, क्योंकि स्पाइक प्रोटीन बाइंड करता है ACE2 रिसेप्टर को। अगर उसमें म्यूटेशंस हो जाएंगी तो उसका बाइंडिंग ह्यूमन ACE2 रिसेप्टर में डिफर हो जाएगा। एंड इन दिस केस ये जो JN.1 म्यूटेशन है उसमें L455S म्यूटेशन है। ये म्यूटेशन जो है वो ल्यूसीन सेरीन बन गया है, एंड जब अमाइनो एसिड चेंज हो जाता है तो उसमें प्रॉपर्टी चेंज हो जाती है। इसमें देखा है कि JN.1 जो है उसमें RO वैल्यू इज वेरी हाई, दैट मीन्स ट्रांसमिशन फ्रॉम वन पर्सन टू अनदर पर्सन इज एक्सट्रीमली हाई, सो इट इज प्रोजेक्टेड दैट JN.1 विल सून बिकम द डोमिनेंट वेरिएंट। तो हर एक वेरिएंट को वो सरपास कर जाएगा, एंड यू वुड फाइंड दैट JN.1 इज द कॉमनेस्ट वेरिएंट ऑल ओवर द वर्ल्ड। जैसे पहले हुआ था, पहले वुहान स्ट्रेन आया, उसके बाद एक म्यूटेशन हुआ D614G, उसमें एक म्यूटेशन अस्पार्टेट ग्लाइसिन बन गया, और उसके साथ इतना वेरिएशन हो गया कि ऑल the spread of the virus became high, it became very high, and soon it replaced all other. उसके बाद fear यही होता है कि this mutation has increased the spread, but the affinity for ACE2 receptor has decreased, so the chances of severe infection are low. Infection increase हो गया, severity decrease हो गई. That means actually it is causing what you would call as natural vaccination. If you wanted to vaccinate somebody, then you will get a strain like JN.1, where many persons will be vaccinated and they will not suffer from disease. Though इसमें देखा है कि इसमें थोड़ा सा mixed bag है, because they keep reporting 1 or 2 deaths. Number of admissions or number of visits to emergency rooms have not increased.
Okay.
Number of hospitalization has not increased. But deaths are still occurring. That means that it is not completely a harmless virus, and those persons who are immunocompromised or those persons who have comorbidity are still at risk. That would mean that we should not let our guard down. It might be doing good work for the society. That would mean because it is spreading very rapidly, so many persons are getting vaccinations, in a way a natural vaccination, and hopefully they will be protected by further infections by the same virus or related virus. जो हमने वैक्सीनेशन लिया है उसमें थोड़ा सा क्रॉस प्रोटेक्शन है, though we do not know what is the immune correlates for protection. हमने वैक्सीनेशन तो लिया, उसके बाद एंटीबॉडीज बने, एंटीबॉडीज से एस्केप कर जाते. JN.1 is escaping from the antibodies, but it has been postulated that cell-mediated immunity might be giving us protection. That is why we are not suffering. Most of the persons are not suffering from severe disease. There is no increase in visits to the emergency room. There is no increase in hospitalization. But persons who are immunocompromised, who are having comorbidity, might still be, it might tip the balance against them. So they should be careful.
जिनकी इम्यूनिटी कम है, जिनका
और
इम्यूनिटी
comorbidity
बहुत लो है, उनको केयरफुल रहने की बहुत ज़्यादा ज़रूरत है. तो इसके सिम्टम्स क्या हैं डॉक्टर?
सिम्टम्स तो वैसे माइल्ड है, but it's the same as with Omicron or with any of the COVID virus. That means there may be running nose, there may be fever, there may be breathlessness, there may or may not be decrease in loss of taste and smell. So normally common symptoms to respiratory tract.
जो हमने जैसे 2020 में जब ये कोविड फैला था चारों ओर, इट वाज अक्रॉस इंडिया एवरीवेयर, जो सिम्टम्स तब देखने हमें मिले थे, तो वही सिमिलर सिम्टम्स अभी हमें देखने
Milder,
मिलेंगे?
much milder. So there are no new symptom. But of course, in the West, they also are saying that during this winter season, there's not only COVID which is circulating, there's
Okay.
also influenza and there is RSV. So this is a triple endemic. So three viruses are circulating. All three of them have common symptoms, respiratory symptoms. But it is there that in case of influenza, a person feels knocked down. There is severe weakness, and you feel that you can't do your job well. While in case of children, RSV is the one which is the culprit. In case of COVID, अगर COVID का पर्सनल सिम्टम चाहिए तो उसमें है लॉस ऑफ टेस्ट, स्मेल एंड टेस्ट, बट अदरवाइज इट्स लाइक कॉमन कोल्ड. So you cannot, on clinical grounds, you cannot differentiate between common cold, COVID, influenza, and respiratory syncytial virus.
Doctor, people who are residing in metropolitan cities or urban areas, they are exposed to a lot of pollution because naturally during winter especially pollution levels are high. तो उनके लिए रिस्क बढ़ जाती है to being infected by JN.1 or COVID subvariants?
See, it is, of course, people living in NCR are said to be smoking 30 cigarettes, whether they are cigarette smokers or not, right? So that itself is risk. I was hearing a surgeon speak that he started doing surgery in Delhi. He was a student in All India Institute in 1988. Most of the lungs that he will operate on would be pink. And now he rarely sees that kind of lungs. He mostly sees black lungs. So there are risks involved. But they're not specific to COVID. So there's nothing specifically that because of the smoke or the bad atmosphere that we live in, we are at increased risk of COVID. It's the same. In fact, for asthma, it has been suggested that asthma persons who suffer from asthma, there are two studies. One study indicates that the severity of COVID may be decreased, and another study says that no, if you are asthmatic and you get COVID, then it will be severe. So at the moment, studies, there one paper indicate that it is severe in asthma, and another study says no, asthma protects you from COVID to a certain extent. It's been suggested that asthma में IL-13 increase हो जाएगा. IL-13 increase हो जाएगा तो उसका affinity for ACE2 receptors decreases, so उसमें वो नहीं होगा. इसी तरह डायबिटीज़ में है. डायबिटीज़ में ग्लूकोज लेवल इंक्रीज हो जाता है, तो उधर एक there is 1,5 anhydrous dulcitol that decreases, and that has affinity for ACE2 receptors, and it binds to spike cells, and that's why they say that when a person has diabetes, there's increased severity of COVID in diabetes.
Okay, somebody who's diabetic needs to be more careful
yes.
compared to somebody who is completely fit and fine. So people with non-communicable diseases, people who are more prone to getting themselves infected need to be careful.
They would have more severity. That is what is the indication, especially for diabetes.
Okay. Even a recent research, Japanese scientists, it has shown that this COVID new variant can trigger a global heart risk or heart failure.
See, उसमें ये है कि जो COVID virus है, that spike protein binds to ACE2 receptors. So वैसे we think that this is a respiratory virus, but actually ACE2 receptors are there on the intima of the blood vessels. In the internal part of the blood vessels, there are ACE2 receptors. So so that COVID will bind to the ACE2 receptors on inside of the blood vessels and cause inflammation. जब inflammation हो जाएगा तो roughening हो जाएगा तो उधर damage हो जाएगा. Damage would be, that means the blood vessels are damaged, and wherever the blood vessels are there, that area will be damaged, and as a consequence, it could be a brain stroke, it could be heart attack, it could be kidney ailment. So these are the vital organs which can be damaged. Though they have noticed that once you start studying, so that is the theoretical background. But so when you give vaccination, then if you study the risk of heart attacks after COVID infection or after vaccination, it appears that, and no vaccination. So if no vaccination is zero, then after vaccination, the increase of risk of heart attack increases by 1 or 2%. But after a COVID infection, the increase is 14%. So that means the risk of heart attack after COVID disease is 7 times more than after vaccination.
Okay.
So risk is there, but after disease it is much more than after vaccination. And whether JN.1 particularly, but as I said, the results in the lab indicate that it doesn't have affinity for ACE2 receptors. So transmit करेगा, मगर इस receptor के साथ का ज़्यादा affinity नहीं होगा, तो फिर वो consequence of that would be that there will be less inflammation. If there's less inflammation, less chances of heart attack or something.
कभी कभी ऐसा भी होता है कि हमें कुछ एलिमेंट्स नहीं है, कोई सिम्टम्स नहीं है, बट हम पैनिक करने लगते हैं. हम सोचते हैं कि हमें जैसे कॉमन कोल्ड हुआ, हम ये माइंड में सेट कर लेते हैं कि हमें जैसे कोविड हो गया है. तो समटाइम्स व्हाट हैपेंस, क्रिएटिंग एन इमेज अबाउट द डिजीज इन योर माइंड, कैन दैट लीड टू criticalities?
Well, it's all in our mind. As you say, is that it is not the trigger, but our response, which actually determines whether we stay healthy and happy or become sad and depressed. So mind does play a very big role, but I think knowledge is a good vaccine. So once you know the right information and you looked at it in a dispassionate manner, not emotional. Some people get very attached to a few facts and they keep on hammering that fact all the time. If you look at totality, then this now Omicron and the variants that Omicron has brought in is now become more like a common cold. So we have to live with it. And sometimes I feel that let the Western world do as more research as they want. We have more pressing needs for using our resources, which are not unlimited, for diseases which are sure to kill, like whether it is prevention of HPV or treatment, diagnosis and treatment of tuberculosis. These are much more pressing and important than the attention that COVID now in this year is getting.
Doctor, is there any reason then for us to panic about this new variant or the new variants that are going to come in the near future?
Well, nobody can predict the future except for Nostradamus, but I would suggest that if we adapt some of the good practices that we've learned over these years, some of them are low tech, some of them are high tech, we would lead a much better life. The low tech has been shown everywhere is that when you shake hands, you transmit infection or you transmit viruses and bacteria from one hand to the other. Youngsters are doing fists bunting. That also transmits infection. So I think the Indian system of saying namaste is the safest method for greeting each other. Second one is to maintain a distance of about 2 meters. If we maintain a distance of 2 meters, then everybody's viruses or secretions remain apart. The third one is that whenever we have any symptoms, we should be wearing mask. If both the persons, those who suffer and those who are healthy but are going in a crowded place, they wear mask, that gives them protection. That gives both person protection. The fourth one is having good ventilation. Normally, it was noticed that COVID spreads more in household contacts because the ventilation in the household is poor. It did not spread too much in the schools, but influenza and respiratory syncytial virus can spread. So they noticed that if you increase the ventilation in the schools, then that will decrease the chances of infection. So would be the running of fans in a well ventilated room. One place where we are always at risk is using the lift and the crowded lift. So in that we should make sure that we have this exhaust fan working well in the lift. So that will decrease our chances. Washing hands frequently is also a good step. Now, if the hands are obviously dirty, then we should use soap and water. But if they are clean and there's no dirt in our hand, then maybe using alcohol rub, which takes 30 seconds, vis-a-vis washing hands with soap and water, which takes 2 minutes, will save a lot of time in the whole day if we have to wash our hands 30 times or so. But because the alcohol rub has emollient in it, then our hand doesn't dry, even though the active principle is spirit and it takes 30 seconds to clean the hand. So those are the low-tech techniques. The high-tech techniques are in the room. We can have a room air purifier. Then if we are going to have a lot of dealing with public, then we can have a glass partition. But along with glass partition, where the person is coming, when the visitor is coming, the vent should be on that side, so that whatever virus comes in with the person is then pulled out and thrown out of the room. There's also evidence that using ultraviolet light when the room is not occupied, if you use ultraviolet light, then the viruses will be killed. So combination of all, and of course now that we have many vaccines available as well as drugs available which can be used against COVID, should give us protection that one, the virus has weakened. Second, we should decrease our chances of getting infection by using these common sense practices. Third is we should have taken the vaccination. The fourth one is that we have drugs which can take care of infection once it occurs. But at this moment, there is no evidence that we should take a booster dose of the old vaccinations. In the West, they have made an updated vaccination using XBB virus variant. So that has cross protection, but using the Wuhan strain vaccination would be of no meaning now.
So somebody who's taken that booster dose, like we all took dosage of vaccines during the previous COVID strains. Now somebody who's already taken those vaccines, are they safe from this subvariant?
See, as I said, we don't know what is the immune protection for this disease. There is evidence that antibodies protect it, but even if a person did not have antibodies, the T cells, the cell-mediated immunity protected. So And there is evidence that Wuhan strain also caused cell-mediated immunity, which will give cross-reactive protection. Even though there is immune risk escape from antibodies. So yes and no. One, the virus has weakened, so it is no longer. If it was Delta, then we would not have been sitting quietly like this, right? It is Omicron variant after variant and variant, so it has lost its affinity for the ACE2 receptors and causing severe infection. That is what, so the virus is weak, we are more protected, and now we have more armaments. So at this moment, there is no cause of worry, but at the same time, we should be vigilant. And surveillance is the price that we have to pay for protection.
So doctor, as you said, we have to be vigilant. To be vigilant, we should take tests frequently or periodically. So what are the tests we should take so that we know कि हाँ ये deficiencies हैं हमें या हमारी immunity इतनी strong नहीं है तो हमें ये precautions लेके बाहर जाना चाहिए. तो कौन से ऐसे test determine करेंगे कि हमारी immunity कितनी strong है और हम कितने healthy हैं?
See, एक तो है general health and diabetes, pre-diabetes is one risk factor, asthma or the antibodies to or allergy to allergens is another factor. So general health is one. The second one will be that if we have severe infection, then we should immediately when we feel that this is something out of ordinary, we should get it tested. And maybe in testing, the testing should be for not only SARS-CoV-2 but also for influenza and for respiratory syncytial virus. So then we will be able to make a diagnosis. Though in each one of them, normally there is no need for us taking any specific antibodies, a specific treatment. But what is required is then we should not go to work. We should not expose others. Normally, the tendency of Indians is that no matter what, जो काम करना है वो तो करना ही है. But it is there that if we go to work when we are having common cold or if we are having infection, then we'll spread the infection. So we should take a day off or take a week off and work from home. And work from home has now become the standard practice also. Yeah. And I think even HR understands that work from home is possible. And so it's the sincerity that matters, but I think common sense must always prevail, and we should take precautions to safeguard our health and to make sure that our colleagues do not suffer from infection.
Doctor, what do you think? There will be another lockdown where people will be confined to their rooms, their homes, and they will be working from the closed doors?
God forbid, but those were extraordinary situations. We did not know what was happening and we didn't have any armament with us. That is why now each government has set up task force to plan, and I think WHO as well as FIND have got things in place that within 100 days of any new infection coming, they would be able to get diagnostics in place. So I think it's getting preparedness for any future catastrophic involvement. And but it is there that even in this, initially when we didn't have any treatment, we knew within a few days, we knew what we were dealing with. We knew that this was a new virus, there's no vaccine available, there's no protection against it, and we knew that people are susceptible. So common sense practices will always prevail, and I think this is what we should, we need to be strictly implement whatever we decide. Then we cannot give exceptions. We cannot have odd even and give exceptions. That doesn't make sense. Then those are politics rather than policies. So policies should be followed, whatever is the policy decision, and hopefully we don't come to the situation where lockdown and disruption has to be done.
Doctor, the last question. Irrespective of COVID, what are the daily life routines that we should inculcate for a better health and a better lifestyle? चाहे कोविड हो ना हो, हमें ऐसे कौन से डेली रूटीन, हमारे डेली रूटीन में कौन से ऐसे हैबिट्स इनकलकेट करने चाहिए ताकि कोई भी डिजीज़ हमें छूने से पहले ही दूर हो जाए?
The associations are given a list of vaccinations. There are vaccinations which are normally given to children, but I think more and more new vaccinations which adults could take are also been prescribed, and wherever possible, the vaccination is one system. The second one is that a person should exercise for half an hour or so, should have regular habits, and should use common sense practices. I think, plus of course it's your genes and your upbringing that all contribute towards healthy lifestyle. And I guess I noticed that those who are fat, they want to become thin, and those who are thin, they want to become fat. There was time when I was thin. There time now that I put on weight. Every 1 year in my MBBS, I put on 10 kgs, and somehow I've not been able to lose. But I think I'm good with it. And there was times when I used to be a wicket keeper, so going up and down 60 times in every hour, and now I barely move from one place to another place. But yes, I think you should be happy with whatever you have and try the best that you can. And I think that would keep the disease away.
Happiness is a choice, and if you are happy, you are already healthy. So things, as they say, what you think you become. जो आप सोचोगे, अगर आप सोचोगे कि आप डिजीज्ड हो तो आप डिजीज्ड हो जाओगे, पर अगर आप अपने आप को मोटिवेट करोगे, सोचोगे कि yes, I am irrespective of any condition in and around me, I am going to stay fit, I am going to follow a regular routine to be healthy, then आप healthy रहोगे. और no matter your body structure, no matter how, whether you're obese or you're thin, अगर आप healthy practices अपनी daily life में inculcate करोगे, you will be healthy no matter what. Thank you so much, Doctor. You took out your precious time and joined us, and I am sure your words are going to enlighten a lot of people and tell them the true facts. They will be aware of the facts that is related to JN.1 rather than hold any kind of notion and be scared or panic about it. They will be aware of the JN.1 variant and take necessary precautions to stay safe. Thank you.